My name is Feroz Mahmood and welcome to the sneak peek of our upcoming Boston Structural Heart course. In this presentation, we'll go over the development of the inter-atrial septum, its clinical significance, and why it is important for the interventional echocardiographers to know the precise embryological development and the anatomy of the inter-atrial septum. Hope you enjoy the presentation. The development of the inter-atrial septum is a complicated process in the uterine life. The primitive atrium is a one large cavity without any definitive septation into the right or the left side, and only has the presence of endocardial cushions on the caudal side of the primitive atrium. The separation into the right and left side starts with the development of the septum primum that grows from the cephalad portion of the primitive atrium towards the endocardial cushions. However, it does not completely fuse with the endocardial cushions, and there remains an opening between the left and the right side, referred to as the ostium primum. When seen from the side, as opposed to the front that is on the right side, it appears as a septum that separates the right from the left side, with an ostium primum intervening between the edges of the septum primum and the endocardial cushions. Primitive atrium in the intrauterine life is a busy place. The septum primum continues to grow from cephalad to the caudate end towards the endocardial cushions, and by the 6th week of intrauterine life, the septum primum has completely fused with the endocardial cushions, completely separating from the left from the right side. However, while the septum primum is fusing with the endocardial cushions, there is breakdown at multiple locations at the cephalad end of the septum primum, leading to a communication between the primitive right and the primitive left atrium in a hole which is referred to as the ostium secundum. Simultaneously, there is also appearance of the ostium of the SVC into the right atrium and the ostia of the left and the right-sided pulmonary veins into the primitive left atrium. Therefore, despite closure of the septum primum, there continues to be a communication between the right and the left side for the transfer of oxygenated blood from the right side to the left side in the fetal life through the ostium secundum. So at the end of the 6th week of gestation, we have reached a stage when the septum primum has completely fused with the endocardial cushions that are contributing to the formation of the atrioventricular valves. There's a fenestration on the cephalad end of the septum primum, also called as the ostium secundum, which is the conduit of oxygenated blood from the right to the left side. The SVC has further divided into the SVC and IVC ostia in the primitive right atrium, and the left and the right pulmonary vein have also given rise to upper and lower pulmonary veins on the respective sides. At this time, there is formation of the septum secundum on the right side of the septum primum. This is not a true septum, but as a matter of fact, an extension of the extra cardiac space filled with connective tissue on the right side of the septum primum. So it covers the septum primum completely except for a small portion which is referred to as the fossa ovalis and has the primitive septum primum in its floor. This is also called the fossa ovalis and is of great significance for understanding of interventional echocardiography and transseptal puncture. So as the atrium takes its final shape, we have the opening of the SVC and IVC in the right atrium, the left upper lower, right upper and right lower pulmonary veins opening into the left atrium. There is this extension of extra cardiac space on the right side of the primitive septum primum, also known as the septum secundum, the fossa ovalis, and the floor of the fossa ovalis, which is formed by the septum primum. And the tiny communication between the flap of the septum primum and the thick part of the septum, which is the superior extension of this extra cardiac space into the right atrium, is known as the patent foramen ovale. Now we will discuss the importance of the knowledge of the intricate development of the inter-atrial septum and its significance for interventional echocardiography. As you can see from this graphic, that the thick portion of the inter-atrial septum, often referred to as the septum secundum, is not the true inter-atrial septum but an extension of extra cardiac space between the right and the left side. And the fossa ovalis, with its floor being formed by the septum primum, is the actual or the true inter-atrial septum, which can be crossed directly from the right to the left side. Therefore, If the septal puncture needle was to go from the superior edge of the septum secundum, it would go through the extracardiac space before it go from right to the left side. The same goes for the inferior septum secundum, that a septal puncture needle would go through the extracardiac space before it would go from the right to the left side. And fossa ovalis is the only true intra-atrial septum which can be directly accessed without going to the extracardiac space from the right atrium to the left atrium. Thanks for watching the presentation. I hope you enjoyed it, and stay tuned for the online launch of the Boston Structural Heart Disease course. Thank you.